Hello everyone, and welcome to our webinar series, Working with Stoma Patients to Address Their Needs. The primary aim of this series is to provide specialist clinical training to meet the CPD needs of stoma care nurses, with a focus on the nurse-patient relationship. As a secondary objective, these sessions will aim to engage and empower people who have a stoma to encourage confidence, understanding, and safe, effective self-care. To achieve this, the clinicians leading the sessions will invite their patients to join in the session and engage in a dialogue. This series is run in association with the British Journal of Nursing's Stoma Supplement and Stoma Tips, the magazine for ostomates. I'm the editor of Stoma Tips, as well as the editor of Gastrointestinal Nursing and the host of Gincast, the Gastrointestinal Nursing podcast, and I can answer any questions about all of our publications in the chat. This series is sponsored by Pelican Healthcare and Respond Healthcare. Pelican Healthcare is a leading manufacturer of ostomy products for the UK and Ireland healthcare markets. Meanwhile, Respond Healthcare provides award-winning prescription and dispensing home delivery and support services to the stoma and continence care communities. Representatives of Pelican and Respond are here to answer your questions, and they'll be in the chat, where you'll also find links to the Respond and Pelican websites. Coming up later in the series, on Thursday, the 11th of February, not too long from now, we've got another webinar in the series, The Freedom to Show Off a Stoma or to Keep It Discreet, which is going to be presented by Meg Tremaine of Truro Treliske Hospital. You can also catch up on the first session, titled The Power to Take Control of Life After Stoma Formation, which was presented by Natasha Rolls of the University Hospitals Bristol and Western NHS Trust. Before we start, I've got a few small points of housekeeping. First off, please use the Q&A tab to submit your questions to all the speakers. It's on the same bar as the chat, and you can see it says Q&A at the top. Just click there and type in your questions whenever you think of them, and we'll answer them at the end. All these sessions are recorded, and they're going to be available on demand within 24 hours of this going live, so please do share it with people. And CPD certificates will be emailed to you directly within 2 weeks. And once the session's over, could you please complete the feedback form so we know what you think and what to do next time? So, on to today's session. It's titled Easy Intimacy and Restful Sleep, Free from Ostomy Interruption. Our presenter for tonight is Amanda Gunning, who's the lead stoma care nurse specialist at Royal Devon and Exeter NHS Trust. Now, I'll hand you over to Amanda.
Thank you, Ben. So I'm really looking forward to speaking to everybody this evening about easy intimacy and restful sleep. How do we broach the subject and discuss intimacy and sexuality within the context of our roles? How do we understand the complexities and considerations that our patients or those of you with a stoma have when aiming to carry out and on with the new normal? The opportunity to discuss intimacy and sexuality is often missed during our early interactions with our patients due to the delicate nature of the subject. Often there's a reticence from the stoma nurse as to how to broach the topic unless asked directly by the patient, and I think we've all been in this situation. However, if the subject's not discussed preoperatively, people may be taken by surprise and can be extremely distressed by the profound impact that a stoma may have on their intimate lives. We have an understanding that our basic needs should be met, and these would encompass sexuality, intimacy, and relationships. Not just sexual relationships, but family and friends should be encompassed in this too. So this evening, what we're hoping to achieve is that actively we can engage ostomates to talk about intimacy. We can help ostomates achieve a healthy sleep pattern and understand how a supportive therapeutic relationship can build confidence. But really, we want to listen to our patients, respond to their needs, and learn from what they have to say. Defining sexual health. Respond to their needs and learn from what they have to say. Defining sexual health. According to the World Health Organization, it's a state of physical, emotional, mental, and social well-being in relation to sexuality, and not merely the absence of disease, dysfunction. Respond to their needs and learn from what they have to say. Defining sexual health. According to the World Health Organization, it's a state of physical, emotional, mental, respond to their needs and learn from what they have to say. Defining sexual health. According to the World Health Organization, it's a state of physical, emotional, mental, and social well-being in relation to sexuality, and not merely the absence of disease, dysfunction, or infirmity. As stoma nurses, we often first meet our patients to discuss pending surgery. Our patients' well-being is already being impacted either by treatment process, ill health, or the thought of the pending surgery. At this point, even after surgery, we really believe that the last thing they may want to discuss is intimacy. So this is a basic overview of some of the most common issues following surgical intervention on men and women. It's important to have an understanding of these issues and how they will impact on sexual function and intimate relationships. So we're only going to, briefly cover this. For men, surgery may result in damage to the nerves that control ejaculation and erection and cause altered sexual function. The amount of nerve ending damage depends on the location of ligation during surgery. For example, the risk of impotence is very high in men who undergo radical cystectomy. Sexual dysfunction may also take the form of retrograde ejaculation or dry orgasm. In this instance, the bladder neck fails to close properly during orgasm, resulting in semen entering the bladder rather than being forced out through the urethra. Sterility, or an inability to produce sperm, is also a complication of radical surgery, and the loss of the rectum for those that engage in anal intercourse can remove a major source of pleasure. And for women, sexual impairment for women can occur as a result of nerves or tissues being damaged. The vagina may have been shortened or narrowed, and this may cause dyspareunia, which is pain during intercourse. Scar tissue from the pelvic surgery may also create bands around the vagina, leading to tightness. Pelvic surgery also results in the drying of the vagina's natural lubrication. Tightness and vaginal dryness lead to friction and pain on sexual intercourse. So lack of lubrication may also be a consequence of the menopause or removal of ovaries, decreasing estrogen production. However, expressing sexuality is more than sexual intercourse. How do we broach this subject with confidence? And often this is at a time of crisis. Having conversations about intimacy can be one of the most challenging that nurses and healthcare professionals can have with their patients. As stoma nurses, we're focused on the physical aspect of the surgery and management after surgery. I know we talk about the psychological impact and body image changes, but how many of us are comfortable mentioning sexual function and intimacy after surgery? Developing a trusting relationship is key to helping our patients, and we are best placed to build a therapeutic relationship as we follow our patients throughout their journey. However, patients may not be aware that sexuality and intimacy fall under the remit of the stoma nurse. So how do we open the door to that conversation, and who opens it? So, developed in the mid-1970s, Anon's PLICIT model is a tool for both assessing and managing a patient's sexuality concerns. And PLICIT is an acronym for the following. P equals permission. Mentioning sexual concerns while also addressing cancer, stoma, and surgery-related changes gives your patients permission to think about the two together. This validates the topic. This action lets the patient know that sexual issues are recognised as part of the care provided by the stoma nurse. It may be that the patient doesn't think this is a discussion that they should have with you, and permission is required to start the discussion. LI is limited information. Give the patient limited information about the sexuality changes that can stem from treatment. Examples might be, what is important to expect when sexual intercourse is resumed after surgery, and the adaptations which might be needed to resume a satisfactory sexual life. SS is specific suggestion. So make specific suggestions that address sexual dysfunction. For instance, if the patient complains of vaginal dryness, suggest you use a vaginal lubricant and safe sexual positions. IT is intensive therapy. So if the patient needs more intensive therapy than you can provide, refer as appropriate. Know your referral pathways and have that information at hand. In using the implicit model, permission giving comes in multiple formats. For example, in my previous role, we used to give out the quality of life after stoma formation questionnaire to patients to fill out whilst they were waiting to be seen. It takes about 10 minutes to fill out and all questions need to be answered. We then use this as a tool to address any concerns regarding stoma problems, intimacy and sleeping issues. And it really helped us open the conversation and gave the patients permission to openly discuss concerns rather than us waiting for them to give a throwaway comment as they left the room, such as "I'm still sleeping in the spare room." These messages can be communicated in a variety of ways. You could have posters or books on display or have written information in the area. Bird discusses permission giving in writing a letter to the patients outlining expectations when having a stoma review. And this included intimacy and relationships, making the patients aware that they can discuss this topic during the consultation. So having received such permission to be a sexual human being and to have sexual concerns without being judged, patients are more likely to feel able to raise any sexual concerns on their mind or to answer questions of a sexual nature more openly and confidently. In some instances, permission giving and the provision of limited information may prevent any further difficulties from arising. In my present role, I instigated a study day with a sexual counsellor for both the stoma and colorectal team. So this exercise helped the whole team gain an understanding of how to open the conversation about intimacy and to talk to our patients with more confidence and with an understanding that this is part of our role. It was reiterated then that conversations about sexual concerns are part of the remit of the service. Sexuality is seen as important and patients won't be judged for having concerns. This service would be offered confidentiality, but obviously being clear about those limitations and where to get confidential help if you couldn't do it there. Help is available. Make sure the patient is comfortable in the clinic environment. Create a safe and private space. This is the stuff we do anyway. Anticipate or highlight that there may be some difficult moments and understand your own sensitivities. Go slowly and know some soothing and calming techniques. Understand professional boundaries and referral options. Be sensitive and understand that some patients may be reluctant to discuss intimacy due to cultural beliefs and values and beliefs. And we as nurses must convey empathy, respect, and open-mindedness in order to develop the therapeutic relationship. Some of the team were concerned how they might introduce the subject, so the use of NIP may help. So generalize, talk about how a stoma can impact on many parts of our lives. Normalize and make it personal, and ask for permission. One of the planned outcomes of the session was how to facilitate the questioning and where to start. Sometimes finding the right questions are challenging, but some of these might help. However, an easy way to start the conversation is just to say, a stoma can affect many aspects of your life, which may include intimacy. Is it okay for us to talk about this? Even if they're not ready to talk at this point, you have opened up the topic, and this can then be revisited during future discussions. Remember that you don't have to know everything or to have all the answers. The implicit model identifies that not one professional knows everything, and always be mindful of your limitations and what can be handled at that session, and refer for intensive therapy as required. So, thinking how the stoma may impact on an individual and understanding everyday management after stoma formation will guide and support our practice. Listening to those who've had experience of living with a stoma enables us to share management suggestions and gain a better understanding of the everyday concerns and considerations. So I can't wait to introduce you to Jade. Jade had a stoma formed at the beginning of the first lockdown period for coronavirus. She had a history of ulcerative colitis, and after management, it became apparent that she'd require surgery. Jade had a total colectomy and formation of an endoileostomy. So here we can listen to Jade and I chatting about her experiences with a particular focus on intimacy and sleeping since her surgery and stoma formation. Hi, Jade. Thank you so much. Thanks so much for agreeing to share your journey and some of your experiences with us today. I just wondered, would you be happy to just have a little talk about how you came to have your stoma?
Yeah, of course. So I was diagnosed with ulcerative colitis a couple of years ago, and I trialed all the medications that were given to me, and I just wasn't responsive to any. So the option for me at the end was to have surgery. So that's how I ended up having my stoma.
Brilliant, thank you. And obviously that's when you met us in the hospital. Did you get to speak to a stoma nurse before your surgery?
Briefly, it was quite a quick surgery decision. So I had a few phone calls, and I asked all the questions that I needed to, but I did manage to speak to some nurses before I ended up going in.
Brilliant, good, okay. So tell me a little bit about what you spoke about before your surgery. Were you able to ask the sort of questions that helped you think about surgery and then how you would manage afterwards with your stoma?
Yeah, they told me, I asked all the questions about what I'd be using, appliances and healing times and things like that. And then I was also told about having visits afterwards and what would be done and what would be done in hospital. So I felt quite positive of what I knew going into hospital and knowing that I was in good hands.
So you felt you had a good understanding of the surgery and the stoma and how you're going to manage?
Yeah, I got sent a welcome pack too, but because my surgery was quite quick, I didn't get it until I came out of hospital.
So, yeah, you didn't get a chance to have a play with it?
No.
Absolutely. So I just want to ask you some questions about intimacy. So as stoma nurses, we talk about this a lot. I'm just interested to know when you first started thinking about that, and when you first, maybe if you had to access any information, or if you actually just talked yourself through it.
Well, obviously I was going into it a bit in the dark because obviously it was quite quick, and I didn't really have much time to think. So it was kind of a thing where I'd reach out to different people whilst I was in hospital, and I'd ask nurses about it, and it was something that I kind of had to come to terms with quite quickly because it was a quick decision, but I did manage to get all that I needed to know whilst I was in hospital from either nurses, you guys, or just the internet.
Did you find social media quite helpful at that time?
Yeah, definitely, because I have an Instagram account solely for IBD purposes. So, and a lot of people on there have ileostomies and colostomies and Crohn's and colitis. So it was quite easy to go on there and ask people about how to feel more comfortable and what life will be like. So that was definitely a big thing for me.
So you felt that the social media supported you planning how you might feel and how you might come to terms with the stoma after surgery?
Yeah, because it was more so like I could find so many young girls my age all around the country that are in the same position, so I didn't feel as alienated from other people, because it's something you commonly don't, you think of an ileostomy and you don't think of a 19-year-old girl, which is what really helped me to find other people the same age as me in the same position.
And did you feel comfortable talking to them about intimacy and sex?
Yeah, I mean, my first conversation about intimacy was with the stoma nurses, but I feel like if I was ever in the position where I needed to ask questions about intimate things like sex or periods, I could easily go on there and talk to people about it because they understand how to feel, if you know what I mean.
Yeah, you feel that they're in the same position as you and have a good understanding. Yeah, absolutely. So just talk me through how you felt that you were going to be when you first left hospital and being intimate. I know you've got a boyfriend.
Yeah.
Yeah, are you able to talk about that a little bit?
Yeah, I mean, I think he knew as well as everyone else that I was really scared about having it, and I was scared about people seeing me initially. But he was there to get me from hospital, so he was one of the first people to see me with my stoma, and he was kind of like my primary carer when I came out, just to be there if I needed things. So he helped me get changed if I needed to, and I don't know if it's the same for everyone, but because I feel so comfortable in my relationship and with him, it wasn't too difficult to open up. But obviously there's going to be some days where I look at my stoma and think, ugh. But he's always there to be like, you know, you're beautiful the way you are, and it doesn't matter as long as you're healthy. So when you're in a relationship like that, it's quite easy to open up and be open with your insecurities and things like that.
So you felt comfortable?
Yeah.
And what about friends and family?
I mean, when I was in hospital, I told all my close friends and family as well. And then when I came home, it was nice because in lockdown, it was obviously quite hot, and I didn't really own any high-waisted bikinis or things. So I did buy one eventually, just for out of the house, but it was nice to just sit and I'd have my stoma, well, not my actual stoma out, but my bag out, and I wouldn't feel, you know, embarrassed at all because they know how ill I was before I had it. So for them, it's kind of a relief that I'm not in and out of hospital 24/7.
Absolutely. And did you feel that, was it different actually, because it was lockdown at the time? How did you feel about meeting up with people, and when did you do that?
I mean, I didn't really meet up with anyone until we were allowed, but it was mainly just my family in the garden, and we do online quizzes and maybe talk about it for a couple minutes on there, but not too much. But when I did start going out, it was nice to see my friends, and they knew about it, and they understood if I needed to quickly pop off to the toilet, or if I had a little extra bag in my handbag for something, and they'd always be really supportive about what I needed to do, which was nice.
Yeah. So going back to being with your boyfriend, when you were first intimate, I know that we had an email at work about this. So tell me a little bit about that if you're happy to.
It was quite, I don't know, it was obviously a scary thing to be completely, you know, vulnerable with yourself for the first time, especially in a situation like that. But I'm really lucky to have, you know, someone like my boyfriend, because, I mean, I'm going to be honest, it really hurt for the first time after my surgery. So that's why I emailed. But he was like, we'll stop, we'll take it as far as like when you're ready. I'm not going to sit here and cause you to be in pain. We're not going to bother. And obviously it was a bit weird for me because I was like, oh, is this how it's going to be forever? But it was kind of a case of step by step and little by little, and it eventually went back to normal. But it was nice to have support from all the stoma nurses and Jake too, just to put my mind at ease and not feel like abnormal, if you know what I mean.
Absolutely. And did you find that being able to email the department, did that help you?
Yeah, because sometimes it will be out of hours and I couldn't call. I know I could leave a voice message, but I faff and I just waffle. So sending an email is just so easy because I can just pop on my phone, tell you what I need to tell you, attach some pictures if need be, and I usually get a reply the next day, or if I send it in the day, it's usually the same day. So it is definitely something I used a lot.
Yeah, quite a good way to contact them. Totally agree.
Definitely.
Okay. So if you felt that you were having troubles and you were emotionally struggling, who would you turn to?
I mean, I've got quite a good support system, because having an operation, I did suffer afterwards, and I spoke to another stoma nurse, and she gave me a lot of resources to be able to help myself with mindfulness resources, TalkWorks phone numbers, and a GP if I felt like it needed to go that far. And me and my family have quite an open relationship, so I feel like if I needed to talk to them about something, which I have in the past, I could easily bring it up. And the same with my boyfriend. It's just, I don't ever feel like I need to bottle things up, because I know that everyone will be there for me, which has definitely been a big help since everything's happened.
Absolutely. Thank you for that. So I want to ask you a little bit about sleeping. I just wondered, since you've had your stoma, have you had to change anything when you're looking at your bedtime routine, or what you wear to bed?
Well, I haven't necessarily changed what I wear to bed. I mean, I probably would if I was not sleeping in a bed with my boyfriend, if I was with a friend, for example. But I mean, I do stay up a little bit later in order to empty my bag before I go to sleep, which saves me waking up in the night, because sometimes, not really here, it's weird, it depends on different locations. When I'm here, I don't wake up in the night, but if I'm at my boyfriend's, I always wake up in the middle of the night to go and empty my bag. But I usually empty my bag at around 11, half 11, so I don't need to wake up. But other than that, there's not really any changes that I've made to my routine.
Do you ever worry that the bag might leak at night?
Yes. It just depends on what I've eaten that day or what I've done. If it's coming a little bit loose, but not loose enough to change it, well, if I can be bothered, that's the thing. But I've been quite good to not have suffered from many, but it's not too much of a worry. But once it's happened one time, for the next couple of days, it's a worry that it might happen again, but it never does.
No. Okay. So you don't feel that you've had to change your pajamas, or the way you wear them, if you're wearing pajamas or anything like that?
No, I mean, if I'm sleeping in a bed by myself, it's fine. But if I slept in a bed with anyone else, I'd probably be comfortable enough for them to know about my stoma. So I don't think I'd change my pajamas or anything. Just be what's comfortable.
Absolutely. And so what about diet? I'm thinking about bedtime. Have you had to change when you have your main meal at all, so that you get less output during the night? Have you changed anything?
I mean, I've usually always had my tea at quite an early time anyway, because I've always had younger siblings. But I do think that I wouldn't have it very late. And if I do still feel hungry after my tea, I'll only have a light snack, because I know that if I eat too late, I will be up in the night. But sometimes getting up in the night isn't too much trouble. So if I do fancy something before I go to bed, I will eat it, but I just will know that I will need to get up in the night if I'm prepared to have that snack.
Would you ever set your alarm clock, or is it something that you automatically wake up?
I think my body just wakes up when I'm not sure how it works, but I wake up and it's ready to go and be emptied. I've never had to set an alarm, which is quite lucky, especially when you sleep in bed with someone, then hearing an alarm go off all the time. So having my body clock waking me up is quite helpful.
Absolutely. So asking these questions is really about getting this information to make sure that as stoma nurses, we've got a better understanding of what you're going through. And everything that you're talking about today is really going to help us in helping new patients coming through prepare, really. So do you think using either social media or whatever media that you use, that helps other people?
I think it would, but I mean, it's different. It's a subjective thing. People might find it useful, some might not. But there is a big community of people on Facebook and Instagram and things like that. There's a Crohn's and colitis organisation on Facebook where people talk about troubles and worries, and the same with Instagram. And you just get people's opinions that have been through the same thing. So you can't ever ask a question that's too silly or unimaginable, because everyone goes through completely different things. So nothing you ask is ever odd to anyone. It's something that most people, or some, have probably experienced themselves.
Absolutely. Well, Jade, thank you so much for that. You've been so honest with me. I really appreciate it. I think that everything that you've spoken about will, ring true for lots of people who are listening to you. And it will be really great if later on you'll be able to be available for people to ask you questions as well, if that's okay.
I can make myself available.
Thank you very much. Thank you. So listening to Jade, we gain an understanding of how having strong relationships and supportive friends and family can really aid coming to terms with stoma formation and living life to the full. Tripaldi highlights the importance of strong and positive relationships in aiding acceptance of stoma formation, and Jade is a really great example of this. Communication is key to this. For example, Jade saying when she was uncomfortable during sex. The impact of stoma formation on body image and self-esteem can be debilitating. As Jade has said, being able to access support through multiple points, be that face-to-face with family and stoma nurses or via social media, gaining support and information from a wider resource, Jade feels supported and knowledgeable, and is even able to help others from her experiences, even at this early stage. For some people, having a stoma and having to wear a stoma bag can have a negative impact on body image. However, this can be minimised with a number of accessories. There are bag covers that are made to measure in multiple materials, support wear and support belts. In particular, they can hold the appliance in place and cover it up. Support garments may also help with muscle support when being energetic, may help reduce the risk of developing a peristomal hernia. Soft bands that cover the abdomen help some people during intimate moments, and some men find these helpful if they believe the bag is flapping around, and there is a wide range of products and support available. There are now a wide range of products and underwear or lingerie that are specifically made for people with a stoma, and having access to all of this information is really important. There are crutchless options for both men and women, as not everyone wants to get totally naked. And it's important to offer the brochures or a guide to everybody of the appropriate products that are available and the online resources. So although Jade didn't have to change many of her usual practices at bedtime, it may be helpful to have a conversation with your patients about sleeping comfortably. For example, some patients are worried the bag will leak if they roll over in their sleep, and an appropriately placed cushion may aid comfort and add reassurance. There are support belts with a guard for those people who sleep on their stomach. Worrying that a stoma bag may overfill, particularly in ileostomy, is a concern, and it may be appropriate to set an alarm to reassure and reduce anxiety so that it can be emptied prior to this happening. Although, as Jade said, she now wakes automatically. For those people with a high output ileostomy, using an overnight drainage system which collects into a bag at the side of the bed might be helpful, but this is something that would need to be discussed with the stoma nurse. With a colostomy, change the bag at bedtime or make sure the bag is empty. Using a two-piece product, you can change to a larger appliance at bedtime, and this could be useful. Some people with an end colostomy are able to irrigate. The stoma nurses, we're well placed to offer this option, and some people are still teaching this in irrigation during COVID with full PPE. Irrigating the colostomy may help give back some control. A cap that fits over the stoma, like it's a small stoma bag with a filter, can then be worn. Some people who have regular bowel action can wear a cap or plug during sex. Just remember there's no capacity with the cap, and the plug itself goes inside the stoma. There's a wear time and you need to gradually build up. The stoma nurses will be able to discuss this with you. Neither of these options are suitable for those with an ileostomy or a urostomy. When it comes to food, some people either change the time they eat a main meal or eat slightly earlier so the bag may not fill so quickly overnight. For example, some people eating beans for the evening may cause the bag to blow up with wind, and this can cause a leak. As Jade mentioned, she may want to not eat or drink something she knows that will cause the stoma to be more active at night if she wants a restful sleep, or she will set the alarm. I sometimes suggest keeping a food diary in the early days to isolate what might be problematic. When wearing pyjamas or boxers, make sure the waistband is not constricting the bag so that it cannot drain to the bottom. If you have a urostomy, then this will need to be emptied before you go to bed, leaving residual amounts of urine in the bag. Once the drainage tube is attached, the urine will drain into the overnight bag and reduce the likelihood of an airlock. Open the tap if it's not a bung. I know it sounds obvious, but we sometimes forget these things. Ensure the tubing is not twisted, and some people may use some tape or a fixing device to secure it into place. For some people, wearing a support belt at bedtime helps them feel secure. For those who wear a convex product, that's the bag with a bump in the back of it, wearing a belt attached to the belt loops at night may stop or reduce leakage by pulling the convexity into the body. If leakage is a problem at night, then a review by a stoma nurse is appropriate to assess the stoma product, as convexity or a deeper convexity may be required, and also some supporting products. So we also have the privilege this evening of hearing from Janice, reflecting on having a stoma and considering any impact having a colostomy may have had on forming new relationships. Janice's husband, Cliff, also joins us in the conversation. Janice had her colostomy surgery at the age of 33.
Hi, Janice. Hi, Cliff. Great to see you. So thank you so much for agreeing to have a chat with me today. Realistically, I just wanted to chat to you, Janice, about having a colostomy, and I just wondered if you could give me a little bit of an idea of how you came to have your stoma.
Well, 30 years ago, when I was 33, I had bowel cancer. I was going to the doctor, thinking something's not right here, having to go to the loo a lot and then passing blood. But I did go through the stages of it's piles, it's colitis, it's IBS. And eventually, when I came to the RDNE at Exeter, and I saw Mr. Irvin, the bowel specialist at the time, he said he took a biopsy and he said, I think you may need to have a colostomy. I mean, in 1990, I had no idea what a colostomy was, and went back and had a look in the library because there was no social media, nothing on TV, certainly nothing that I could find out about. So that's how I started off on the colostomy route.
Yeah, so you said you went to the library. What information was there?
It was very technical, and it was. I went in the reference library. I don't know if people still go in much in the libraries, but I picked up a reference book and looked at all these surgical equipment and whatever, and I thought, oh my goodness me, and it was really daunting, but it's so much better now with everybody, but that's what I did. It was too technical for my little head.
So when you had your surgery, did you have stoma nurses in the hospital?
Oh yes, there were stoma nurses, and there is one stoma nurse that was a stoma nurse back then, Mandy. 30 years ago. So yes, there were stoma nurses, but
yeah.
Not like they are now.
So how do you think having a stoma at that time, I think you were in a relationship, weren't you, or married?
I was married.
How do you think that impacted on your relationship?
After I had my stoma in 1990, at the age of 33, 2 young children, 7 and 9, to be fair, my husband just wanted me to get better. And so he treated me just as if I'd had any other illness. And in time, yes, I mean, we did, our physical relationship started again. We split up 9 years later, but that was just so be it as such. I mean, you don't know about going back over the time now as such, but it wasn't anything to do with the illness.
Thanks for that, Janice. I appreciate that. When you first had your stoma and you were obviously in a relationship, did you want to talk to anyone about intimacy, or do you feel that you were able to talk to your husband at the time?
I think it would be good to be able to talk to someone apart from your husband or partner, whatever relationship you're in. And as far as a lot of the time, the nurses talk about the medical side of things, and there isn't always someone to talk. Or I think a lot of us sort of feel, well, I don't know, should we be talking to the nurses about sort of things other than medical? And is perhaps on our side as well, that we don't come forward and say, should we be talking to someone? I mean, maybe there should be someone trained in that side that's not quite so strong on the medical side.
I think nowadays stoma nurses see that as part of their role, and hopefully this is what this is about, raising that in that profile and getting a better understanding of how we would address it and how we talk about it, and giving that permission to talk about it, exactly as you said, Janice, because I think some of the time we're not mentioning it and the patient doesn't want to mention it either. That is a challenge. Cliff, I've got a question for you then here. How did you feel when Janice told you about the fact that she had a colostomy?
Well, I was a bit apprehensive because I didn't really know much about what that meant, to be honest. But we'd known each other for a while then, and we'd got quite close. So when it actually came to it, it was okay. It didn't make any difference. It was all right.
So you felt comfortable?
It was all right, yeah. Probably because I got to know her over a mere matter of how many weeks was it? It was
5 weeks.
About 5 weeks. So, I mean, there were some things which struck me as funny when I said about wearing a 2-piece swimsuit, going out swimming and stuff, and she wore a 1-piece thing. I thought, well, it just went one ear and out the other. I didn't really make much of it, but it all came together then, you see, what was happening. But it was all right.
So when she told you about it, yeah, okay. So Janice, are you happy to talk about when you first start to get physical and be intimate and how that came about?
Yes, well, as I say, we sort of waited a few weeks until we had got to know each other. So really, I'm reiterating what Cliff said there, as far as it felt like the time was right. So dare I say, we booked a weekend away, but maybe like you sort of thinking, oh, it's going to be sort of wham bam and whatever. Well, like and maybe you build it up to be something, and you've also got to remember with us, we've both been married before, we're no youngsters and whatever, but so we booked a weekend away, and as far as dare I say, I had a little bit of a leak, but
well, I've got to say, at the time we were going great guns at the time.
You're doing well, Cliff.
Even though we're not youngsters, yes, all right, but so yes, we just brushed it off, and so be it. Then the next week, I'd got a stoma meeting. I ran a meeting at Crediton, and then the following week, Cliff proposed to me. So it can't have been that bad.
That's brilliant. That's brilliant. Thank you for sharing that. I think that really helps. I think we talked about that previously, didn't we, Janice? And I think you said that when the bag leaked at the time, Cliff, you were amazing, but it did impact on you, didn't it? How you felt?
It was a surprise, but I think that you were more upset than what I was, weren't you?
Yes,
You were more upset than what I was, really.
And it happens so rarely, you know, but maybe, as we said, we sort of built it up into a bit of it, and I was perhaps a little bit nervous. And
I think that probably because you were wearing a smaller bag at the time, not one that you normally wear. And that probably caused it. But it's all right.
Yes.
Moved on from that now, anyway.
Yeah.
You're married now.
Yes, we got married almost a year later, so we didn't rush into things. But he did propose then, and we both got grown-up children. Yes.
So let me ask you, Janice, when it comes to sleeping, have you ever had any concerns or issues about how you might sleep? You know, what you might do at bedtime? Any specific routine that might help other people?
Well, I think just make sure that perhaps you have an extra press at the seal, and just, I mean, you can get flange extenders. I don't personally use them, but I think the main thing is to make sure that I always change my bag just before I go to bed. And I think sometimes it does tend to, you know, be active in the night anyway. But I think if you change your bag, you feel comfortable. And to me, it doesn't make any difference whether I sleep on my side, my back, or on my tummy, whatever. But I think if you feel, you know, if you change your bag before you go to bed, then you feel a little bit more secure. And to start with, I used to sort of almost feel, well, perhaps I should sort of, if I stayed away, take a little hand towel or something like that and just put over me, just as a little protection. But I certainly don't worry about it at home. And I really can't think when I've had a leak at night. And I do know that some people do, and that's not good. Again, it's making sure that they've got the right type of bag, or the flange extender would help as well.
Okay, thank you. And do you think that you've ever modified your diet because of sleeping, or, you know, like, let's say you might eat earlier or eat your main meal at lunchtime? Have you ever changed anything?
I haven't, no. I don't think it's sort of perhaps a good idea. I don't drink that much, but you sort of think, I don't know about having too much to drink, sort of like too soon just before you're going to bed, you know, because I think that can, you know, make it a bit loose, and then that could potentially give you a leak. So keep the drinking to earlier in the evening. That would be
good advice. Fantastic. Now, I know, Janice, that you're a great advocate for Colostomy UK, and you're a buddy for us at Royal Devon and Exeter. It's amazing. Tell me a little bit about that, and about the people you meet, and really what sort of things they're asking you.
Right, okay. Well, I'm a volunteer with the Colostomy UK, and so I go on the helpline, and people often are concerned that they've got sore skin, and they could be perhaps having leaks. But anything like that, though, we always refer them to the stoma nurse. Of course, they tend to ring up in the evening because, you know, places are closed and whatever, you know. So it tends to often be things that you refer them to the stoma nurse. And as to being a buddy, I think one of the main things does crop up as far as I've spoken to. I've always had lady buddies, but I don't know. I don't see that it matters to have a man as somebody that you want to talk to. But quite often it tends to be whether it's single people or people in relationships. You know, they feel that perhaps they can talk to me because I'm outside of the stoma department as such, but I've had a lady to say, you know, that I don't think I'm ever going to meet anyone again. She was similar age to me, and she since has emailed me to say that she's met a chap, and as far as she said, she'll let me know how it's going. But dare I say, in this particular time, I've not heard from a little while, but I will email her and see how things are progressing. But of course, with COVID, she's probably not been able to meet him very much. But it does tend to be the topic, really, whether people are in a relationship or not, as far as you know, how are they body image, shall I say, that tends to be the main thing. And I do miss with COVID that we've not been able to have any support meetings, and I just really do hope that nobody is isolated. And that's my next thing to do in the next few days, is to email people, and I have got one or two people that don't have email, and I should be ringing them and making sure they're all right, because we just not got any support meetings, whether it's be the IA or the ostomy meetings, and it's such a pity, but we have to do this.
Do you find having social media helps?
It does, yes. I do think that a lot of people do look to social media, and they look to, I mean, on the closed Facebook site for the Colostomy UK, they look on that site, and sometimes they'll see the answer, or, you know, or not the answer, but have you tried, you know, is quite often a sort of way to put it forward. And I think a lot of people do get emotional support from the closed Facebook site. Sometimes they use that rather than perhaps a call.
Absolutely. Thank you, Janice, and thank you, Cliff. That's amazing. I really appreciate it. And I do think that everything you've talked about today will be very interesting for people to listen to, and I'm sure lots of people can relate to your story. So thank you very much.
Well, thank you.
Thank you, Janice. So we're just going to show a few lovely pictures of Janice with Cliff, living life to the full. And here she is swimming and having a cream tea. Usually there's a lot of pictures of Janice eating things, nice ice creams and cakes. So, reflecting on Janice and Cliff's experiences during intimacy, although planning is good, it doesn't mean that there won't be accidents. So having a sense of humour to manage the situation will help. I think Janice depicts that fantastically. Looking at the practicalities, people may choose to wear a covered pouch rather than a clear one. And people with a urostomy often have a clear pouch, so a cover may be useful. Looking at pouch style, you may want to trial a different pouch type, as discussed previously. Some people eat less, slightly less, or use Imodium prior to sex. Some may wear the stoma appliance at an angle to keep it out of the way during intimate moments, although a lot of the drainable appliances now fold up out of the way. If it's an early morning cuddle that you may want to go to the loo and empty or change the bag first, it just may take more planning, as Janice talked about, but communication is key. So, as stoma nurses, we're in a privileged position to support people to live fulfilled lives. Listening and reflecting on what Janice and Jade have said, I'm aware that I do try to use the information that I've learned from the everyday experiences of those living with a stoma to those who have recently had surgery. As a nurse specialist, there's an expectation that I understand the physiological and psychological impact of stoma formation. Drawing on the experience of those living with a stoma, I hope I can help those struggling in the early days to adjust to the new normal. Support groups can be a lifeline. Not everyone wants to attend an open day or a coffee morning, and I know in these times that's not even something they can do. But for those that do, this is a place to feel less alone in the future. Accessing the right local group at the right time can be guided by the stoma nurse, and the associations such as Crohn's and colitis, the Ileostomy Association, Urostomy Association and Colostomy UK, and I'm sure there are others I haven't mentioned, have online resources and Facebook groups where people may feel more comfortable about talking, particularly when it comes to intimacy. As Janice and I mentioned, she's utilised her experiences to support others. There will be people who don't want to start the conversation relating to intimacy with the stoma care nurse, and people like Janice and Jade are best placed to offer advice and guidance at this time. They also have an understanding of their limitations and know when to refer back to the stoma nurse for support. Sharing experiences with someone who's living that life may be crucial. Asking our patients if they'd like to speak to somebody who's living with a stoma is important, but it must be an ongoing conversation because the first time we ask is not always the right time. We are here for every step of the patient's journey, and they're at the heart of everything we do. With that in mind, we should use every available resource to support them, being able to draw on the knowledge of those living with a stoma and using our enhanced communication skills to start difficult and often challenging conversations. We may be able to signpost earlier, preempt issues and concerns, and highlight pitfalls before they become a challenge that feels insurmountable. Thank you for listening. And hopefully I'll be able to join you now for some questions. Thank you.
Great. So let's jump straight into the questions. I'll do goodbyes, etc. later because we got lots of questions. So let's get going. So there's for everyone, I believe. So wait for Jade to come back on. Let's start with finding some first. So, oh, hi Jade.
Hiya.
So, just digging through this question list. Anyone who's still got any last chance to pop your questions in the Q&A now. So Ginny Hill asks, how long in general are people's, oh wait, no, that's now moved, so I've lost it. How long in general are people's stoma clinic appointments, as there is so much needed to address?
Hi, is that for me?
Yes, that's for Andy.
Yeah, absolutely. We're really lucky at RD&E. I'm now going to for 45 minutes. I think that's a lot longer than many people have.
Oh, Janet, could you mute yourself?
Janet, causing problems.
You might want to say that again, Mandy.
Yeah, just to say, we're very lucky at Royal Devon and Exeter. We have a 45-minute consultation. That's changed. We used to get half an hour, which we found with everything you're addressing now is not long enough. So, yeah, we're really lucky, 45 minutes.
Fantastic. And I've got a question for Jade here from Vanessa Coleman. So Vanessa writes, Jade, you'd be a fantastic person to speak to patients who are heading towards needing a stoma. Is this a role your local stoma care nurses have asked you to take on?
Well, no, it's not. But, you know, I speak to, like I said, I use social media a lot. So I talk to a lot of people on there. So I kind of just take everything I know and push it on everyone online.
Right, so you're doing it without being asked, essentially.
Yeah.
That makes sense. Oh, Mandy?
Yeah, hi. Obviously, as one of your stoma nurses, we tend to do use the buddying technique. So we send out paperwork and we ask people to become buddies We do that usually after a year after post surgery, and it's been really early on in her journey, but she was fantastic and really kindly said she'd talk for this. And I knew how active she'd been with social media, and certainly moving forward, that's something we'll be asking her to do, because I think she'll be a great advocate and a great patient support.
Fantastic.
Thank you.
And a question from Sharon Behan. So to Jade, what did you use to keep your stoma and bag safe while being intimate, if you don't mind the question?
I don't think I really did anything. I think I just had my bag on, just like normal. I don't really change anything. Well, if there is anything, I haven't really used anything, so I just kind of leave it as it is.
I think Janice mentioned that she talks to people sometimes about using flange extenders, maybe at the time if needs be. So if anybody's interested, I think that sometimes does help some people.
I would just say, Janice, if you'd like to join in and unmute yourself to talk, what I recommend doing is if you turn your sound down, so it's quite quiet, the sound coming out, it won't get mixed up so much. Yeah, sounds good. So let's see. I can still hear myself a little bit, I'm afraid. Maybe if you just keep yourself muted until you're talking and keep it down as much as possible. But do join in when you can, because good to hear from you. So this is, I guess, a question for anyone who wants to answer, but from Natalie Smith. Is it more difficult to ask about intimacy with older ostomates, people in their 50s and 60s and older? Do we think they're less inclined to discuss this topic, or are they more familiar?
So from a stoma nurse perspective, I'm old now, so it's easier, I think. I'm in my 50s, and I think when you get a bit older, maybe you feel more comfortable talking about things. I think some of my colleagues did find it really difficult, especially with their older age group to start with. So using some of the techniques that I discussed during the presentation had helped them. I think what also is difficult at times, if people come in with family members, for example, an older patient might come in with their son or daughter. And so before now, we have actually asked them to leave so that we can discuss it. So it's finding what's comfortable for you and how you're going to do it. And at the beginning, when I used to do this, I used to write the question down beforehand, as a prompt, and find a sort of way of talking about it in a calm way. Maybe Janice and I talk about this, about being a little bit more, not jokey about it, but trying, if you can build that rapport with your patient first, I think it does help.
Excellent, thanks. Anyone else want to come in on that, or move on? So this is
I just wanted to say that sex doesn't stop when you're in your 60s either, stoma or otherwise.
That's very good to hear. Only things to look forward to. So this is a question for everyone, really, because I think we all would have seen some of this. So from Jill Skipper, do you feel there are more positive or negative comments on social media and blogs and things like that about life with a stoma?
Jade, you might be good.
I don't know. I think comments and posts are different, because I know a lot of people post videos of them with their stoma or their bag, and they're trolls that comment nasty things. But other than that, it's on Instagram and Facebook, because I'm part of groups, it's mainly just people. Obviously people whinge about it every now and then, that's guaranteed, but it's usually just people seeking advice or empowering other people. If it's negative, it's usually someone upset with the position that they're in, or if they're in pain. It's never some people have down days like I do and say, or sometimes I wish I didn't have my ileostomy, but it's never, I think the positives of the comments definitely outweigh the negatives, for sure.
In my experience as editor of Stoma Tips, the magazine for ostomates, I find that when people communicate with others, they do in this world, there does seem to be a great desire to kind of support and reassure each other. So it seems to be very positive vibes in general, but also through following the social media stuff, of course, you see people sort of posting stories saying, "Oh, I'm having a terrible day. This is causing me a lot of anxiety and stress." But then when you see someone who in general, you know, is living a full life and seeing that they have bad days, it's perhaps a relief to know that we all do. And, you know, seeing other people vent can be quite cathartic, I think. So any more comments on that side?
I think I go on social media and I follow mainly Colostomy UK just to look at what's happening and if there's any support I can give. And I always follow the post. So I think, right, is everyone answering? What are they saying? Are they helping? And I've only stepped in, I think, twice just to give sort of really clinical advice and about going back to your stoma nurse. So only recently, actually, there was a real topic on sex. And it was brilliant. It was going really well. I thought, oh, this is, you know, really relevant. And one person sort of seemed to put a stop to it by being, you know, saying something. And sometimes that can be quite sad when you see that the conversation then stops. But, you know, yeah.
I see what you mean. One question of my own, I guess I'd ask is about the kind of two negative sides I can think of social media. To start with Facebook, I think too many people believe what they read on Facebook. And I wonder, has anyone ever had any experience of seeing people offering what seems like dodgy advice online on stoma, like Facebook groups or anything?
Mine's not Facebook so much. But on Instagram, a lot of people comment about herbal medicines and that if you're taking medication, you're, you know, giving up or you're not doing whatever you can. Or I had one person tell me that I could, if I went keto on the keto diet, I would cure my illness.
Oh my God.
Oh.
So you do get a lot of people. It's mainly like herbal medicines, diets, and things like that. People saying that you can cure your illness.
It's all basically magic, isn't it? Or is the idea that you can just wish something better, which can't be a good thing to make people think when it doesn't work for them. Because I'm not wishing hard enough. Or to avoid, if people avoid seeking actual medicine. So, Mandy, what do you think could be done by clinicians to kind of, I guess, reach people who might be vulnerable to woo-woo on the internet?
I think it's really difficult. I think we do signpost better now. We were really mindful about signposting social media and to websites for a long time, but Coloplast has brought out a really good piece of information that we can use, that we use to signpost now. I think it's really hard to actually police it in some, you know, we always say, you know, we give guidance on what information you should look at. There are going to be people out there that are going to have woo-woo, whatever you say, and Jade obviously, you know, sees that. And actually, our stoma nurses, are we best placed? Not really. I think well educating our patient and getting them out there to talk to other people, and they're the ones that actually can stop some of this information that's misinformation. In my opinion, there's probably much more out there we can do, but you know, I think we're using more of it, but more appropriate.
That sounds like a good approach. The other sort of related question I had about social media is with Instagram in particular, it tends to skew towards younger and more conventionally attractive people. And, you know, we're on First Stoma Tips, we're on Instagram, and there are a lot of very, very beautiful people on there. But I just wonder for people who don't necessarily look like Instagram models, is it, if the effort is all in that space, is that a bit alienating for people who don't have the look and style of that world?
I think you see, like, sometimes it is quite a toxic place. Like, sometimes you can look at like a famous model with like a completely flat stomach, and I'm like, oh, she hasn't got a bag on. And like, but then on like my IBD side of Instagram, I've got a girl that had 3 bags at one time. She had fistulas and things, and she got followed by Anne Summers for promoting that. And I had one girl, she got put into a misguided campaign with her bag out doing a modelling shoot. And I think I get what you mean a lot. It's so hard because you're constantly comparing yourself to like the famous viral people that don't have a clue what it's like to live like with an ileostomy or anything. And I think for a lot of people, in like general anyway, it's a struggle to look at those people and be like, but a lot of the time it's just like not real. It's not. I think that's what people have got to realize. It's someone standing in the perfect lighting, in the perfect way, with the perfect picture. You know, it's not. I think that's the hard thing that people have got to realize, that itself probably isn't the true picture, if you know what I mean.
Yes, definitely. Probably a bit harder now. None of us are actually allowed to live in the real world.
Yeah.
We have to live entirely virtually. Topic.
But I think, Jade, giving that answer just shows how well balanced you are. And I mean, that's amazing, because, you know, some people can't look like that, and some people will want to look at that, if that makes sense. But what you have said, you make sense of it. You're saying, well, actually, that's the perfect lighting, the perfect makeup. They put the old whatever it is that I can't do, wish I could, making yourself look good generally. And so it's not really a true reflection of their true self. And that's how some people get through this, whether they have a stoma or not. And what you said, Jade, I think hopefully we're going to hear more from people like you with a voice like you. So that's what's exciting about things like this. Yeah, thank you.
It reminds me of, I once got a comment on one of our cover pictures for stoma tips, and someone just said like, oh, I just prefer if you had pictures of actual ostomates on rather than a model. And I was like, this person has a stoma. And then the person making the comment was like, oh, I didn't notice. The bag was kind of small in the picture, but I guess it made her rethink what I guess her stereotype of someone who has, like, I guess, has to interface with the medical world. Oh, then you can't be like anyone else, but you can. All kinds of people have a stoma, right? So I think that's probably actually quite a positive interaction. So let's look at some of these other questions.
Janice, have you got
Yeah, can I just quickly say as well?
Yes,
I know, Amanda, you asked for some photos, and I see that you did use one with a swimming costume. I don't think it's very flattering personally, but it just shows that I am a normal person. I wasn't airbrushed. I got white legs and whatever else. I haven't got the flat stomach. Personally, I wouldn't bag out. People do. That's up to them. I personally wouldn't, but I do. I don't mind swimsuit. I don't mind people knowing that I swim in the pool, in the sea, in the river, whatever. But yeah, I was a normal person there.
And that's what we love to see, and that's what people want to see.
Not the most elegant.
But I wouldn't wear, I don't have a stoma, but I certainly wouldn't wear a 2-piece. But if that natural look, I think that's what a lot of people are talking about. And that's really what I think what Ben's getting at, is that we should see more of that actually as well. But that's having the confidence to put your pictures out there, isn't it? It's being confident. And it's a bit like that. Do you want to climb a mountain, or do you want to get to the shop around the corner? What is it?
And I did wear my swimsuit on that fashion shoot at the Ostomy Open Day. but it was a swimsuit.
A question from Wendy Osborne. So Wendy writes, Jade, thank you so much for your openness and honesty. You've highlighted the importance of family and friends who were able to talk, who you were able to talk openly with. Are there any social media websites that you have found helpful for those who may not have that network of friends? So basically, where would you recommend someone who doesn't already have that network to go?
I initially started with Instagram, but I know a lot of people don't use that. But there's a lot of people, you know, from very young to a lot older. And then there's, if not, I just joined Crohn's and Colitis UK on Facebook, because there's always questions going on about there, from medication side effects to advice for going for a scope. And even if it's not a question and you just say, you know, you need someone to talk to, you know, there's always hundreds of people active on the group all the time. The same with Instagram. And I mean, I haven't really used anything else, but Facebook and Instagram are the two things that I've used, obviously, as well as talking to my family and friends. But those two have definitely helped me a lot.
Excellent. Thanks. Anyone else want to chip in on that one? So let's look at these questions as well. Yes, so Lorna Cochran writes, hi Jade. Sorry, Janice, a lot of these are addressed to Jade specifically because they were submitted before your video came up. So I think we can take these as hi Janice and Jade. Thanks for being so open. You come across as a very positive lady with a lot of family and friend support. Have you ever experienced any negativity towards having a stoma, and how did you deal with that?
I would say there's been one time, but it wasn't necessarily about my stoma. It was more about someone dictating to me how I should feel. So it was the day after I came out of hospital, and someone was telling me, well, obviously it was lockdown, so I was going out. I walked to the end of my street and back because obviously I'd just come out of hospital, and I had someone saying, you know, you've got to go again. And I was like, I can't. And then they were saying, you know, I know what I'm talking about. Physio is the best way to recover. I'm not, well, basically it was my dad, and we haven't spoken since I've had my surgery. And he was kind of telling me that everyone has surgery every day and blah, blah, blah. So that's the only negativity I've had. Quite a big one, but nothing, no nasty comments about my bag at all. I've always had nice people, you know, empowering me, and my family are constantly telling me, you know, wear what you want, be what you want. But I've never had comments about my bag. It's more so the situation with my dad telling me what I should be doing and how I should feel.
Yeah, thanks very much for that. That sounds like dealt with that pretty well, considering.
I mean, I've been lucky to have all the support. That's, you know, it didn't affect me too badly because I was overwhelmed with so many different people. I had my mum, my stepdad, my boyfriend, and all his family. They were just amazing. So to be honest, it sounds really awful, but it just went to the back of my head because I had so many other people telling me exactly what I needed to hear at the time.
Yeah. Have you had anything, Janice?
No, I'd say if anything, really positive. I mean, I don't work now, but when I was working, I was helping with training, and I was going from Devon to Peterborough, and they knew that I had a stoma, and we were staying in different hotels, and didn't find a problem. And I know it was quite a long time ago, but I did do a team building course on Dartmoor, and I did abseil off Haytor, and I remember the instructor being very concerned and saying, you sure you're okay about this? You got a colostomy, but it was probably about 10 years after I'd had my colostomy, but I did do the abseiling and I did do the caving, and I was determined I wasn't going to let anything stop me do whatever anyone else did, but they were concerned about it, but it's fine. And no, I can't say I've had any negativity. No.
Sounds like you've got a good circle of people.
Yeah.
Well done for abseiling. I was too scared to do it when I tried.
I'm not going to do it again.
So another question. Where is it? Oh, sorry, I've just bring this up. So yes, it's a question for Mandy. So Pauline Hodson wonders if people feel easier discussing sexual issues with the patients diagnosed with cancer, as it isn't always a priority for them pre-op.
So are you asking, do we find it easier to talk to patients with cancer about sex? Is that right? Or about?
Yes, I believe that's the question.
I can only talk for myself, obviously, and maybe a bit about for my team, and I don't think it makes any difference, actually. I think we just think about patient having stoma-forming surgery. There are lots of implications for, whether it's benign or I think Crohn's colitis is really hefty. I think people are unwell beforehand, so maybe that's an easier subject. I find it easier to talk about knowing that you might be feeling better afterwards, and I don't know if Jade agrees with that. We did talk about that briefly before, but so I think for me, I don't find it difficult. I use it part of my practice for patients with all whether they're benign or whether they're cancer. I hope that.
Thank you. So Sharon Behan asks if anyone knows of any sort of online video conferencing events and sort of like chat places for people with for ostomates to talk together. I guess kind of like this is for nurses and ostomates, but specifically for ostomates. Maybe Janice, is there anything you do with Colostomy UK that's like an online event?
Well, at the moment with COVID, the only thing I do is take part in the volunteers. We have the Zoom meetings, but a lot of well, I don't like to call them members either, friends that we have in our support group, and I haven't done a Zoom meeting as such, but I think that's the only thing I've got involved in is with the volunteers. We have a Zoom meeting, but no, I don't do anything sort of Zoom or WhatsApp, online. I'd like to get back to our support groups, and I do think people do miss that face-to-face and the buddying system as well. But not at the moment, I'm afraid.
I think, Ben, we're really concerned at the moment about people who feel socially isolated. Janice and I had a conversation about this a couple of days ago, and the fact that we've got people who are in the ether, at home without anyone to talk to, and with only their own thoughts for company. As stoma nurses, it's a challenge. I find, I think Janice knows how I feel because I get quite emotionally. I worry that people are not getting the support they require. And there's only so much you can do as a stoma nurse and a nurse specialist if people aren't contacting us. So I want to put it out there that we are still there. Most people are still, if they're not even in their department, are trying to get somebody to answer calls. So we're doing the best we can to support people. But talking to people like Jade and Janice now, and those people that are out there supporting each other, I think that's really imperative.
Wonderful. Thanks so much, everyone. I think because people might have dinner in the oven and stuff, we should wrap up. So I'm sorry to the people who've answered questions we didn't have time for.
Can I just say something?
Yeah.
I need to say
Any last things?
One last thing I want to say, and this is this. Jade and Janice and Cliff, I want to say thank you so much for being so candid with me during our conversations. Thank you so much for this evening. I hopefully feel that this will really help people like me moving forward. And yeah, what can I say? You've been amazing. Thank you.
Thank you. Anytime.
Well, thank you very much, Mandy, for a really revealing presentation, and to Jade and Janice for relating and reflecting on your experiences, as well as to our audience for listening and sharing all your questions. I'm sure everyone's keen to hear more from Mandy, so I recommend you check out the episode she did of our podcast, Gincast, the Gastrointestinal Nursing Podcast. You can look for that on Google. And before we head off, I'd like to remind you to complete the session feedback for us, as well as to sign up for our final session, the Freedom to Show Off a Stoma or to Keep It Discreet, which is going to be on the 11th of February. So thanks again, everyone, and I look forward to seeing you next time.
Thank you.
Thank you.